for a while, I thought that I should be sitting down and let you do the talk. Look, I know it's a Friday evening, and I'm really, really thankful that you're here, because you could be at home in front of a fireplace and open a Pinot Noir and then enjoy a glass of red wine. Maybe you can do that at 10 p.m. tonight. So, look, what I hope to share with you tonight is some tips about building happy and resilient children and adolescents. And by the way, I'm going to tape this, but I'm not going to record you. It's, because a lot of times I actually use some of the lectures that I have for teaching purpose. So I'm just going to record my own talk and upload it on YouTube. Now, as David said, the idea of resiliency is not new. So when you think about that, you can actually substitute the word resilience with psychologically healthy. So all of us like to be healthy. And unfortunately, when it comes to psychological health, it actually lags behind physical health. And it is only more recently that we talk about psychological health and psychological resilience. So what I hope to do this evening is to spend some time with you, probably 1 hour and 15 minutes, and after that entertain some questions and answer in order to introduce to you this whole concept of psychological resilience. And I have to say that really at the end of the day, there's no end point to psychological resilience. It's a bit like there's no end point to physical health. And you keep improving and you try to maintain that. So what I'm trying to do this evening is just to give you some tips about 10 things that you have to bear in mind about building psychological resilience in your children. So the next thing is just a bit of an introduction, just for those of you who don't know me. So I am not a charlatan, and I'm standing in front of you, and I'm a medical specialist, and I specialize in child and adolescent psychiatry or child and adolescent mental health. And I have been in practice now, as David said, probably the last 28 years or so. So I'm actually slightly older than what I appear to be. And in fact, both my kids are married. I don't have any grandchildren yet. Now, apart from my practice, I'm actually interested in empowering young people and family and their parents. So I've actually set up a website, and my website is healthymindconcepts.com. So if you have the time, and if you want to fall asleep one evening, and you can actually go and visit the website. So on the website, there are a number of articles that I write about stresses, about communication with young people, about depression, about anxiety, and about ASD, attention deficit disorder. This is for you to read. And more recently, I've actually designed and created quite a number of psychological toolkits. Now, how it came about for myself to create the psychological toolkits is that because a lot of times in my practice, I come across families and parents and young people who ask me, what should I be doing in between sessions? Because I only come to see you once every 2 weeks, once every 4 weeks, and what sort of skills should I practice? So because of that, I actually put together these toolkits that actually I call the apps on various psychological disorders like anxiety and stress and depression and emotion regulations, attention deficit disorder, in order to help the children and in order to help the families as well. So those toolkits are not substitute of treatment, but rather they are complement to the treatment. So it's a complementary, and it also helps the families and the children and the patients to recover much faster because they can actually do the homework in between. So just regard the toolkits as e-therapist, and it's always there, available for the young person. So my talk tonight is actually based on a number of toolkits that I put together. You can visit my website and have a look at the toolkits. All the toolkits are actually available now on Google Play Store, and we're just waiting for the Apple Store for the approval with the compliance with the iOS. So that's another way that you can access the toolkit is through the Google Play Store. So what we hope to achieve tonight is some understanding of young people. I'm sure that's why you're here. You probably have a young person in the family, and you probably have a young person who is perhaps in trouble, or maybe not. You just want to come here just to gain some understanding in order to help the young person in your life. So I hope that you can actually go away having some skills to help the young person, and also to have some knowledge to determine when the young person needs professional help. And I think that is very, very important. So for example, we know that these days, at any one time, 20 to 25% of young people have some mental health issues. Now when you think about that, it's actually quite high. It's actually 1 in 4. So in a typical school of, let's say, 500 kids, that would be 100 kids who have difficulty. So it's always good these days to consider parenting, not only including providing for the young person physically, but also emotionally and psychologically as well. And if you can bear that in mind, then you're going to bring up very healthy and balanced young people. So I just want to start off with the definition, because after all, tonight's talk is about bringing up happy and psychologically resilient young people. Now there are two ways to define happiness. The first way is to say that, well, it is a positive emotional state in response to something that is positive in the environment. So that is a very minimal definition of happiness. In other words, something happens in the environment that is positive, and as a result of that, then I am happy. Now that doesn't actually require a lot of skills, because basically when you embrace that concept of happiness, you're actually just saying that I'm reacting to the environment. But the second definition, I prefer the second definition, which is a positive emotional state irrespective of the experiences in the external environment. So in other words, I may be experiencing positive experiences, so as a result of that, I react in a positive way and I'm happy. Or I may be experiencing some negative life events, but then I know how to manage that and I still remain happy. Now that takes a bit of skills for us, and that is something that we cultivate. It doesn't come naturally, because human beings, we tend to react to our environment rather than respond to the environment. So for tonight's purpose, I'm actually using the second definition. And of course, the next thing then is to say, what is psychological resilience? Now, the word psychological resilience actually embraces two different concepts. Now, I just want you to think about rubber band. When you talk about psychological resilience, think about rubber band, okay? So, in other words, the first one is that a rubber band is able to withstand the stretching, right? It's able to withstand the stretching. So the first concept of psychological resilience is the ability to cope with the stresses of life. And by the way, when we talk about stress, initially when the word stress was used, it was actually used in a scientific way, in physics, as to study how much pressure and tension you can apply to different metal before it snaps. But unfortunately, these days we have to apply to human beings and the sort of pressure in life and how it can affect us. So the first definition is, how much ability do I have to withstand the stresses of life, just like the rubber band? How much can I actually stretch it? And then the second one, which is very important, is that how much does the rubber band bounces back? So when I stretch it, then it actually bounces back. So sometimes in the course of life, we have certain stresses that we may succumb to that, and we need recovery. So the concept of psychological resilience then is to say, how quickly do I recover? Now, if you think about physical health, right, there is a lot of similarities there. Because when you're healthy, you're less likely to fall sick. But then when you fall sick, you're more likely to recover. So it's basically that. So psychological resilience is my ability to withstand stress, and in the event that I succumb to the stress, how quickly do I bounce back? So we like to bring up kids who can withstand stress. And also we like to bring up kids, if and when they succumb to the stress, it's not like it's the end of the world and everything collapses, but they're going to bounce back rather quickly. So it is very important that in the understanding of psychological resilience that you remember this, because this actually helps you very much to understand mental health generally, okay? Not only for your kids, but also for yourself. So when you talk about psychological resilience, you have to think about stress, and then you have to think about vulnerability. Now, I just want to define, first of all, the word vulnerability. Vulnerability is, what is it about me that makes me more vulnerable to psychological problems? Now, a lot of our vulnerability is beyond our control. So for example, we know that if you come from a family with history of anxiety or depression or different kind of mental health problems, then as an individual, you're more likely under stress to develop that kind of mental health issue. So because of that, I'm vulnerable. So if I come from a family with a lot of relatives and family members who have anxiety problem, then it is very, very likely that I would develop anxiety problem. Now I use the word likely, I didn't use the word inevitable. So it makes me vulnerable, but it's not inevitable that I'm going to develop a mental illness. So the other vulnerability, of course, is our early childhood experience. So for example, we know that kids who have been brought up in abusive families and kids who have been exposed to trauma are more likely to develop mental health problems. So vulnerability sometimes is something that we can't do about. But then on the other hand, you have the stress. Now stress is something that we can deal with. So when you understand that concept of stress, vulnerability, and psychological resilience, then straight away you would think that, okay, look, in order to help my child to be more psychologically resilient, the basic thing is I have to help him with stress management. Makes sense? Because the higher the stress, the more likely that your child is less resilient. So this is a very important concept to grasp. Then on top of that, as parents, right, we need to get an idea about the different facets of our child's life. Now that is very important as well. And different culture have different emphasis on the child's life. So for example, I'm being Asian, Australian, so I can say this, right? So a lot of Asian culture is that education is very important, okay? Education is very important, and it may to the neglect of other areas. But I think this chart helps us to sort of concentrate on our kids and to know that in a holistic way, our kids' life consists of the physical, the emotional, the cognitive or the intellectual, and the social, academic, and spiritual as well. So when we can actually put that in balance, then we are more mindful of the needs of our child. It's just not physical. So parenting is just not physical or providing something for the kids' physical needs. It's not just emotional, and it's not just cognitive, but it's also social, academic, and spiritual. So once we grasp that, then we start to know the needs of our kids. So that is a very, very important concept that we have to grasp. And the next thing is we need to have some sense of our kids' development. We need to have some sense of our kids' development. So the pizza or the pie chart there or whatever, essentially constitute what I learned as a child psychiatrist, okay? So in order to help our kids, you need to know how your kids grow. You need to know the different stages. And I find that this is actually a very, very good way of conceptualizing the psychosocial development of our kids. So for example, when a child, the first thing that the child has to learn when the child enters into the world is this whole notion of trust. Because the child or the baby is totally helpless. So learning to trust, to know that this 2 adults or 3 adults or 1 adult in my life that I don't even know the person at the moment, that I can trust that person, that when I'm hungry, I get fed, when I get wet and I get soiled, and when I'm uncomfortable, that somebody is going to look after me. And later on to realize that, oh, these are my parents, you know, this is mommy and daddy, and then to go on. So the basic foundation of relationships is trust. Then the child goes on to learn about the ability of self-control or self-direction, which is autonomy. Now, so that would be the toddler age, and we know that, for example, toddlers by and large, a lot of them, right, they, one of the early words that they learn is no. But they probably learn it from parents as well, right? No, don't do this, don't do that. But really, the psychosocial development of the child is such that they have to exert some kind of autonomy to know that, hey, look, at this moment, right, I get better control of myself, I can walk better, I can run, and in some way, right, I don't have to be totally dependent on my parents. So the sense of autonomy is very important, and the child goes on to have certain initiative to shape his life, to incorporate his life experiences by way of learning, and then it goes on to what we call industry. This is the time when the child goes to school and being able to apply effort to whatever he's doing, and then later on go on to form some kind of identity, usually in their adolescence. Now this is also the time that where parents, they need to be aware of the need of the child to establish his sense of identity. So this is a time which is kind of like a mirror image of the toddler life, where the adolescents have to test out that the mom and dad's belief, is it real or not? Is it true or not? Okay, and the religion that they embrace, the cultural values that they have, and do they belong to me or not? So they actually have to go through that in order to come out to say that this is me, and this is my values, this is my standard, and this is what I embrace. And with that, they have a sense of identity. So parents who are over-controlling, parents who are insecure, parents who have a sense of being threatened by the child because of the child's need to form their identity, a lot of times it's going to come in the way of that. Now, being a Asian Australian myself, and sort of coming from the Eastern and Western culture, right? And I remember when I was when I was a teenager, and during that time there weren't many Asian Australians. I did go through a sense of identity crisis, because when I went to school, I was the only Asian boy, okay, in my grade. There were other Asians. So when I went to school, I felt like a white person. It's like, I'm Aussie. Then when I went home, it's like, oh, I'm not Aussie. And so there was that conflict in me of how much am I Eastern and how much am I Western. Now these days in my practice, I see a lot of that too, because as you know, Australia, we have a high rate of migrations from or immigrations from different countries, and at the moment, and there's influx of people from the Eastern region, and the young people, they have difficulty. And so because of that, they can have cultural conflict with their parents. And the ability of their parents to know that, look, my child is going through this difficulty at the moment, and my child needs my support, and my child needs my understanding, is very important, rather than putting some walls around and enforcing some cultural values which may not be consistent with the sort of local culture here. So identity is very important, and then after that, the child goes on, or the person goes on to form some kind of intimacy and leave home. So this is roughly the development of a child. So again, when we want to bring up children who are happy and psychologically resilient, we have to know roughly about the stage that they are going through, just so that our response to our child is not going to come in the way of helping the child. So once you get a grasp of the different domains of your child's life, once you have an idea of the child's different stages of development, the other thing that is very important for us to understand is that psychological resilience, right, actually involves a true understanding of one's behavior, one's feelings, and one's thinking. Now that is very, very important. And because that constitutes our person, the way that I think, the way that I feel, and how do I act, and about life, and about the impact on life on myself. So these are some of the kind of like the building blocks that we need even before we can actually go on to talk about how to help our kids to be more psychologically resilient. So the importance of your child understanding and responding and reacting, that the child does not actually live in a vacuum, that I am impacted by people, and when I live in this world, right, there are the normal life events that happens to me, and how am I going to deal with those normal life events? So for example, when I say normal life events would be the child going from the family, leaving the family and then going to preschool. The child graduating from year 6 and going to high school. Now those are normal life events. But nevertheless, even though they are normal life events, they're going to create quite a bit of what we call normative crisis and normative stress for the child. And the reason why it's normative is because everybody goes through that, and that is a norm of the society. And it's a form of crisis because the child has to learn to adapt. So for example, in Australia, the very basic thing of moving from year 6 to year 7, but the school is, you know, in the primary school is 300 kids, 400 kids, excuse me. 300 or 400 kids to a high school of 1,000 kids, right? That is a crisis. The reason why it's a crisis is because I have to learn to adapt. The simple thing of in year 6, I stay in one classroom. When I go to year 7, I have to go to different classrooms, and I have to determine what sort of books to bring to the class. That is another form of change, and the child has to adapt to that. So helping the child to know that in the process of him growing up, there are normal life events that he has to deal with. And on top of that, sometimes kids have to deal with what I call extraordinary life events. So for example, some kids, unfortunately, have to go through the extraordinary life events of mom and dad separating, okay? Grandparents die, or mom and dad having some problems, or the arrival of another sibling. So there are lots of things that would impinge upon the child. So giving the child that whole concept that this is my life, and how am I going to learn about my feeling, how am I going to deal with my thinking, and how am I going to behave in a certain way that is promoting growth in my life, and also understanding the demands of life. So that is basically what we are talking about. And I suppose when you think about it, that is parenting in a way, described in a psychological sense. So helping our kids to understand the interrelationships between emotions and thoughts and behavior, that at the end of the day, my thinking and my feeling and the way that I act are not disconnected, but they're all related to each other. So the way that I feel, essentially, right, is going to affect the way that I think. And the way that I think is going to essentially affect the way that I feel. And depending on the way that I feel, sometimes I behave in a very, very different ways. So the importance of helping our kids to link those thoughts together. And some of us parents, right, we do that we do that automatically, right? You know, because like when our child is not happy, we say, oh yeah, think about some happy thing, right? What are we saying? We're actually saying that when you think a happy thought, perhaps you would have a happy feeling. So we do that quite easily and quite automatically. but a lot of times kids may need a bit more help in analyzing and in understanding his own feelings, and then in understanding the deeper thoughts within himself and learning how to fashion his behavior. So that chart is actually taken from the app that I have called Emotion Regulation Toolkits. And in the Emotion Regulation Toolkits, it's basically deal with the fact that every one of us, we need to manage our emotions. Otherwise, our emotions is just going to manage us. So in chapter 1 of Emotion Regulation Toolkits, right, a very, very basic thing about emotion regulation is to know that emotions are neither good nor bad. It is only a signal about what happens. Now, when you think about that, it seems to be so simple, but when you think a bit further, it's actually quite profound. Because a lot of times, right, we get scared about our emotion. For example, we tell our kids, don't get angry, okay? Now, what we are actually saying is that don't show angry behavior. Because at the end of the day, being angry is neither good nor bad. Being angry is only a signal to what happened. So I am getting frustrated, I get a bit of a sense of injustice. Because of that, I get angry. So teaching our child to learn that I have a feeling, and that feeling is actually an indicator of something that is happening in my life. It's quite simple. When you think about that, it's actually quite profound. Even some of us adults, we don't get that. We don't get that. So for example, why do we get that? So we adults, we may make statement, or kids make statement like, you make me angry. Now there's no such thing as, you make me angry, okay? Because the right statement is, I feel angry. Why do I feel angry? What is the signal about what happens? Oh, because I think that you're being unfair. I think that you're trying to make me do something that I don't want. So it's really very, very profound to you to understand that emotions is neither good nor bad, okay? And it is only a signal. So when you understand that, right, you can extrapolate from there different treatments for some of the mental health problems. So for example, anxiety disorder. The person feels anxious, right? And the reason why a lot of times when a person has an anxiety and it becomes a disorder is because you react to the anxious feeling. So these days we come out with this whole technique of being mindful, okay? In other words, you just perceive your feeling. Same thing as what I've said. Being anxious is not good or bad. It is only a signal about what happened. So I feel anxious because I have to stand in front of everyone to perform and to play the violin. I feel anxious because, in the school assembly, I've been chosen to give a speech rather than reacting to it. So once you understand that emotions is neither good nor bad, it is only a signal, that is in chapter 1 of Emotions Regulations, you are kind of on the right track to help your child to manage the emotions. But that statement is very, very essential. And in my practice, for some of my patients, parents who use that, I constantly have to come back to that and say, now this is what you have to tell your child, right? This is what you have to tell your child until it gets in. So the interrelationship between emotions, thoughts, and behavior is absolutely important. And this is taken from Increasing Your Child's Psychological Resilience Toolkit. And again, as I said before, a person who is psychologically resilient is less likely to feel stress about the same event compared to the person, okay, who is less psychologically resilient, okay? So in order for us to help our child to deal with stress, that's why we have to increase their psychological resilience, and that's why we are here. Now, we are actually living in a world where it is very, very stressful for kids. And I think one of the reasons why kids these days feel a lot more stressful is that they've been burdened with a lot of knowledge. I imagine the days that I was I grew up, and I didn't know about marijuana until I went to university as a medical student. Okay, maybe I was quite dumb, you know, but and no kids in the high school. I went to a public high school, and so we didn't have drug problem, and none of my friends. Now it's not as though, you know, I just hang out with goody tissue and that sort of thing, right? I mean, there are other kids, you know, who are not so good. We didn't have drug problem. I went to university, and then I learned about marijuana, and it's like, wow, you know, there's something like marijuana. And I still remember going to the high school, Chatswood High School. It was not until year 11 that we have sex education. And then even then, you know, it's like, by the way, I wasn't born in the Victoria era, okay? It wasn't too long ago. And it was in year 11, you know, we got told about contraception, we got told about pills and that sort of thing. And these days, kids learn about that in what, year 6? And in year 6, and so kids have been, you know, we bombard them with a lot of informations because of the technology, and because of technology as well, and because of the fact that parents live more stressful life, we get more isolated from each other. I remember when I was at high school, I'm not too sure whether kids do that, right? And on Friday, all my friends will greet each other, you know, have a good weekend. Have a good weekend, everybody. And then when you come back on a Monday, it's like, did you have a good weekend? What do you do? And you go out fishing with your dad and that sort of thing. So there's a sense of well-being, of enjoyment. There's a sense of well-being of take time out and really enjoy. And when they say have a good weekend, they mean it. But these days, it's like, do kids say that anymore? I don't know. Probably not. So kids live in a very, very stressful world. So stress management is absolutely very important. So the next thing that we want to impart to our kids is really this whole notion of being stressed and being relaxed. Okay. Now this is another very important